Hello, me Dr. Yogesh Kumar, a practicing neurologist. And what motivated me for this course, the Rheumatology by BMJ, is that my day-to-day practice, I come across a lot of patients, especially with multiple aches and pains. And either it may be neck pain, maybe shoulder pain, maybe back pain, maybe leg pain. And along with this, their distorted routine activity, their distorted sleep activity, and many of them are getting frustrated and depressed. Second thing, what I come across, many of the cases of vasculitis coming with a multiple rash, especially over the lower limb. They may be purpuric, they may be typical vasculitis rash. They doesn't know where to go, but where they come to me because they are not able to walk. And when I see, then I realize that it's probably undergoing vasculitis is going on, and that is the presentation. And many a times I got the vasculitis presentation, CNS vasculitis. The patient is very critical. Many times they may admitted in the ICU and ward. And next I used to get any of the myositis cases. And for all these spectrum of the cases, I need some expert in rheumatology or immunology. And for that is the area, and that motivated me to take this course. Now next, this course definitely impact me very well, and I understand the basic concept regarding this rheumatology, and but I need little improvise in immunology aspects. So many of our physicians, they should understand however the immune system works. Ultimately this is the defense system of the body, and if it is getting disorganized and dysregulated, it go and knock each and every system and organ of our body. So every primary physician should have an idea of this immunology as well as the rheumatology. So but with this course I definitely got enlightened. I come across many of the cases, its module and its a video, and this is hands-on training program. Definitely it was very effective for me. Now definitely I will recommend this course for the primary physician, because they also, many of us come across many of the cases. Most of the time we are ignorant, we doesn't know what is this going on and what should be done. But at the same time, with this course they will come to know at least a basic idea regarding this rheumatology case, immunology case, and at least we can give some supportive care, and at least we can refer them on time to the higher center or expert rheumatologist or immunologist. Thank you.